Hi, everyone. Welcome back to Facebook Live. I'm back, hopefully rested, ready to go for the next round. Okay, let's start out with, I'm Dr. Annette Mercatante, and this is St. Clair County Health Department's Facebook Live, where we're going to answer your questions to the best of our ability. So first of all, our update, our status report, which can be found on our website as well. A total number of cases to date. This is since March of 2020, by the way, 19,352 with 435 deaths. Changes in the last 7 days. We've had 245 new cases, up to an average new case per day of 35. And we're doing about 300 tests per day with an 8.9% positivity rate. Next slide. And then this is our epi curve. You can see that we continue to slide up. Certainly now a precipitously high slide rate like we saw back in March, but definitely going up, and we'll see what happens next. Next slide. And this is just to review a little bit of the immunization data, a breakdown of ages. Of note is we have for our 75 and older, a 75% plus vaccination rate. And if we go down to all age groups, 55.5% of that's complete. That's just first dose. And when we have looking down into our younger age group, which I'm sure is going to be a hot topic discussing school age kids, we're looking at the 12 to 15-year-olds being about at a 24.2% vaccination rate, and the 16 to 19-year-olds a little bit better at 41.5%. So that's good. The bottom slide I had added because I wanted everyone to realize that we continue to vaccinate about 500 doses a week, which means people are still out there trying to do the right thing and getting themselves vaccinated. And we want to encourage people to continue to seek out vaccine. Lots of vaccine information, lots of vaccine safety issue data, vaccine efficacy data can get kind of confusing, but I can still say we have a very safe and effective vaccine opportunities available to us. And they're free. Next slide. Next slide. I added this slide because I thought we get a lot of questions about vaccine efficacy. And as you can see, the light yellow is those cases that are new cases that are unvaccinated versus the orange, which are the new cases of fully vaccinated. And you can see a dramatic difference. The bottom are just new cases. The middle is hospitalized cases, and the top is deaths. And there is a 7-fold difference between deaths who are unvaccinated versus those who are vaccinated. There looks like there's a three-time increase of, and this is just our local data, by the way. The state's data suggests a 7-time increase of hospitalizations for vaccinated versus unvaccinated. And then new cases, a significant change. So the vaccine does still appear to be working well and providing a significant coverage, especially with severe disease. Next slide. And our dashboard, we'll continue to update our dashboard and try and direct you to the best data that we have available to us. There's also the state dashboard, and soon to come, and we'll talk about this maybe a little bit more, is we will be posting a frequently asked question document where because we get a lot of the same questions, and we'd like to kind of make sure that they're all in the same place so you can see where they are, and we'll update that. We'll get that posted, the beginnings of it tomorrow, and we'll keep it updated as we go along with your questions and concerns. Okay, let's get right to the questions. Jen, what do you want? You want me to start with the talking point?
Yeah, let's start with your talking point today.
Okay,
we put a press release out.
Yeah, the big news this week is our testing, our rapid testing, PCR testing, which we were doing a lot of testing for travelers, particularly travelers over the Canadian border. And not too long ago, we received word that the cassettes, the material we need for the testing supplies are going to be significantly curtailed in the near future. They're not as readily available, and we need to prioritize our testing for those who are exposed or ill, especially with the anticipated increase in cases that we hope won't come, but we suspect will. So we will be no longer providing PCR tests for people who are traveling across the border. There are plenty of tests available to you still. Please check our website for testing availability, but you're going to need to plan ahead because we were one of the few rapid tests available for PCR, and most PCR tests are have to be sent out and are taking a day or two to get back. So if you're planning on crossing the border, make that appointment to get your test done. I believe the border needs something done within the last 72 hours. So plan accordingly. By the way, testing for travelers is not counted in our county positivity cases, and people are only counted in our case rates if they are residents of our county. That must have come up, huh? All right.
Yeah, that came up after we put the press release up, so we wanted you to mention that. All right. We had a lot of questions last night, so we tried to condense as much as possible so we could also do the questions today. I want to remind everybody that this video will be time-stamped and available on our health department YouTube, and you can rewatch it and look for the types of questions. If we didn't get to your questions, you can look to see if they've been answered, because many times we do get a lot of repeat questions. Okay, first question. Are you going to mandate masking in St. Clair County schools?
I love your answer. So we continue to strongly recommend masking in schools, but at this time, there is no mandate.
Okay.
Let me be transparent. A masking mandate will need to be considered every time we look at the data. We're going to let the data direct our next course of action. So if rates start going up in the schools, it will be seriously considered.
All right, next question. Why is it a person who has been vaccinated and comes into close contact with a positive case doesn't have to quarantine, but a person who isn't vaccinated and comes into contact with that same positive case has to quarantine? Don't we still carry and spread the virus even when we are vaccinated?
Well, you can, yes, but this is all about relative risk. So we know that isolation and quarantine policies are not going to eliminate exposure risk, but our goal is to reduce that risk as much as possible while still maintaining people's ability to live their lives, right? Go to school in particular. We want to keep these kids in school. This is our number one goal. So I showed you that graph, right, of how effective vaccines are. So even though you might still get infected with the virus post-vaccination, that likelihood is much, much lower. So with an exposure, the chance of you actually getting infected is considerably less, and we feel it's low enough that it would warrant just cautious allowance of ongoing care. That doesn't mean if you've been vaccinated and you get exposed, you should throw all caution to the wind. In fact, the CDC's recommendation, if you've been vaccinated and exposed, is that you continue to go on with your life, but that you test yourself after about day 3. Was it day 5, I think, 5 or 7, they're recommending a test. So just to make sure that you're not asymptomatically shedding. So let's see, your answer, Jen, thank you for this. In instances of breakthrough infection, including infections with the Delta virus, a Delta variant, those who are both vaccinated and unvaccinated can still transmit the disease. But again, you're a lot less likely to get infected if you're vaccinated. So that's where the disconnect comes from. If you were vaccinated and became symptomatic, you would be isolated right along with everybody else. But this is just exposure and the likelihood of you getting infected. We also had some early indications that fully vaccinated people might be less likely, that may be less infectious for a shorter period of time. And there's just still a lot we have to know. So we will keep an eye on that recommendation. It will change if the data changes. It will change if we're finding a lot of vaccinated people are showing up to their workplace or in school infectious. But for now, this is the guidance of the CDC and the Michigan Department of Health and Human Services, and we are going to align our guidance with that for now.
All right, thank you. The next question, of all kids quarantined last year for possible exposure, how many tested positive and how many had symptoms?
So We don't know the exact number of kids quarantined last year because schools did that, as you know, for us. And as things started rocking and rolling, all those reports didn't get to us. So we do know, though, that in 2020, we had a total of 578 positive cases in the 0 to 18-year-old age range, just in St. Clair County residents that were referred to us. And there most likely were others as well that we just didn't know about, right? So whatever we know of, you can take that number and probably double it, if not more, because we know that we don't get all the information sent to us that we should. So since the beginning of the pandemic, we are aware of 2,468 cases of 0 to 18-year-old residents that were positive. So of those 2,468 cases, only 1,455, or about 59% of them, had any kind of case investigation by us. So a lot of people would not answer their phones. We don't get the information we need to contact them. So roughly half of the cases that we should be able to investigate and identify who the contacts are and find out if they were under quarantine, we don't know. So please take that into account as well. And of the 0 to 18-year-olds with completed case investigations, the ones that we did get in touch with, 83.8% reported having symptoms, and 43.2% were in quarantine or a close contact of a known case when they became positive. So if you look at our data alone, it looks like roughly 43% of 0 to 18-year-olds were in quarantine when they became positive as a case. But again, you have to take all that data, consider that it's reliable as far as trending, and the fact that we know it happens and that this is a real risk. I wouldn't lay my hat on the actual numbers because I think there's a lot of cases that we really didn't have full information about.
All right. The next question, what are the consequences for an individual if they do not comply with the quarantine order?
So we, when we send out that warning letter, that is a cut and paste directly from pre-existing public health code warning letters that we have been sending out for decades. Comes right from the public health code. Essentially, a person or organization who violates the order is guilty of a misdemeanor and is subject to civil or criminal penalties per the code. And this would ultimately be up to the courts to decide what that would be. I just want to say, we work diligently and very hard to get people to comply. We want people to do this voluntarily because it's the right thing to do. And through all the cases that we've had, I can tell you we haven't filed a subpoena or issued a court order on anyone yet. Not to say if it was really nefarious and egregious what somebody was doing, that is our responsibility as a public health. So it's like if there was somebody with TB that was failing to get treatment, or any infectious disease that was not following our recommendations and it was putting other people at risk, that's why those laws are on the books.
All right, somebody asked last night, why are they not testing for COVID at River District anymore, especially when the procedure is done at River District? Are they still using the PCR test?
Honestly, I can't speak for them. I'm not sure if they've had a change in their policy or if they've changed a supply chain. Maybe they're sending them down. You'd have to call River District and ask them directly about that.
The next question was, what data and evidence are you basing your decisions on?
Well, I've mentioned before, we really are trying to stay aligned with the published data and guidelines through the CDC and MDHHS. But we also know, especially now, there's just such chaos, right, with so much of the return to school guidelines set. We also have to rely on experts in the field. There's no way that my team and myself can read every piece of literature that's coming out. And we don't consider ourselves experts in virology or experts in immunology. You know, we look at the consensus of experts and the body of evidence as best we can, and then we base our decisions on that. So I wouldn't say it's based on any one paper or article. We have frequent communications with all the medical directors in the state, for instance, and all the epidemiologists in the state, for instance. And I mean, we just spend a lot of time collectively trying to stay up to date as best as we can.
All right. The next question was, how many kids in the county are currently in the hospital strictly for COVID? Question
So we
7.
don't know how many people. We have hospitalized data, but I don't think they break it down by age. So I don't think I can give you an accurate. I do know that we do get children hospitalized for COVID. I think we reported on that once before. We were able to look at that, but currently I can't speak to that. I don't know how many.
Okay.
And
The
by the
next
way,
question. Oh,
I should mention, and thank you for mentioning. Somebody put this down there, and I should mention children in our community, if they're quite ill, are frequently transferred outside of our county, and they're hospitalized in other facilities, primarily in Ann Arbor and Detroit and Grand Rapids. So if you have a child who's quite ill from anything, but particularly from an infectious disease where they need ECMO or something, they're going to be transferred out of our facilities.
all right. The next question, and this is the last one from last night. If Japan has seen a success with the use of ivermectin, especially with the rising cases after the Olympics, why are we not using it in the States?
Boy, maybe you know something I don't know. You probably read something that is out there. Ivermectin is got very poor clinical trial data. There's not a lot of good evidence to support its use, which is why it's currently not being recommended by the FDA. There's a couple of poor quality studies that really don't support its use, and there's a whole bunch of studies that suggest it's either not helpful or potentially harmful. So the bottom line is we just need to know a lot more about it. We don't always do things just because another country does it. We have a different structure and a mechanism to review information. And again, I'm going to follow the experts that I've learned to trust and believe in before I follow something that a foreign country is doing. But that's just me.
All right. We will move now to the live questions. Brody said, welcome back, Dr. Mercatante.
Thank you.
Cindy said, back to the red zone. When will this end?
Oh, baby, I know. We're all just a little bit shell-shocked right now, and I think that might explain some of the we were talking about the shift in mood, the anger, the blame that we're kind of receiving now. We're not doing anything different, but I think people are really just kind of tired of this. And here we are in our second school year. And everybody just so hoped that we could it was a nice summer too, right? We all got used to doing things. And I've said this before, I think we're going to get better and better at dealing with this virus. We're going to have better therapeutics. We're going to have a better idea of who gets really sick and why and what to do about it. God willing, I hope more people take advantage of the vaccine, because there's no question that's a game changer if we could just get more people vaccinated. And by the way, I did see something, I might as well comment on it now. Somebody said, well, if we've got 50% vaccinated and we're assuming maybe 20% of the population's been previously infected, doesn't that mean that we have a 70% plus immunity level? And the answer is no. No, because a lot of people who've been infected also were vaccinated, and we really have no good way of knowing exactly what that is, but it's probably a pretty substantial amount of people, myself included. Once you get COVID, you don't ever want to get it again, and you do exactly everything you can to reduce it. So there's no way, and plus there's no way we really know what the natural infection rate actually is, because I mentioned before, the data is not super robust. A lot of people don't bother getting tested. A lot of people don't end up, their information doesn't get sent to us. So really predicting the natural infection rate is also very difficult. So I think 70% would be a hugely optimistic and somewhat unrealistic guess. I think it's much less than that. Okay.
Okay. All right, next question is from Danielle. She says, hi, Dr. Merck, long time no see. I had COVID back in April, just got an antibodies test done and have them. How long do you think they will last? My doctor told me what he thinks. Curious on your opinion.
Hi, Danielle. Yeah, hi. This is really tough, and I know doctors are doing it. My doctor did mine too, and here's the problem. There's a lot of variability in the tests themselves. So unless I knew, and I could not tell you which tests are reliable and which aren't, there are hundreds of tests out there. It's the wild, wild west show when it comes to COVID antibodies. And there's COVID antibodies and there's COVID antibodies. There's IgAs and IgEs, and there's, all kinds of variability. So number one, we don't really know which tests we should really hang our hat on. Number two is we don't know what level of antibodies confers protective mechanisms for you as an individual. So we don't know what that cutoff is. So just having antibodies may not be enough. So the long and short is antibody testing is not helpful right now. It doesn't tell you whether you're protected. And if you had zero antibodies, it doesn't tell me that you're not protected, because we know that there is certainly going to be a component of cellular immunity, which is not measured through the blood. These are memory cells in our bone marrow, our T cells, that have learned to recognize COVID and attack it, which might be very effective for fighting off future exposures and infections. And right now we don't know. And that's why some people who've been vaccinated, perhaps with no antibodies, really may have immunity. So unfortunately, there's still just a lot we don't know. And I would follow the recommendations of whatever comes out. For instance, if we do have recommendations later in the fall to get boosters 8 months after your second dose, that's probably what I do. It's going to be a while before we really have a handle on serology and antibodies, I believe. We'll get there, but right now we're not there.
All right. This is from Gina. She says, I have known multiple vaccinated people to get COVID. Why is that they do not have to quarantine? Vaccinated or not, you can still get it and spread it.
Okay, so if you're vaccinated and get COVID, you do have to isolate. Remember, isolation is when you separate yourself from other people because you're sick and you're, theoretically, shedding virus. And quarantine is when you've just been exposed, you're not sick, we don't know that you've been infected, but there's a high chance that you could be infected. And so we try and develop that quarantine system to reduce the impact of that. So if we had everybody who was exposed that went on their daily ways, we know there's a percentage of them that would be sick and then infect other people. So it's a way of slowing that spread down. So vaccines are not 100% effective. We know that people who are vaccinated are going to get sick, and if they do, they should be tested and they should isolate the way everybody else does. But we also know much, much less people get sick when vaccinated. And I showed you that graph, and everything we're getting from across the world is telling us that the vaccine gives you marked protection against getting infected in the first place. And if you do get infected, significantly reduces your risk of being hospitalized or dying. Now, you've heard these statistics as well, but like 99% of people in the ICU with COVID are unvaccinated. It's a remarkable, compelling story to understand that the vaccine is still protective. But you're right, you can't take it for granted. And if you feel if you feel like you might be infected, please get a test and act accordingly.
All right. Several people, again, Doc, are asking about the masking mandate, and you covered that at the top of the show.
Let's just say this. We as a health department are responsible for protecting the health of the community and following the best science available. So we will do what we have to do, popular or unpopular. Right now, we've made a decision not to mandate. We'd like to see the kids get back in school. We'd like to see where that goes. And we'd like to see as many people wearing masks by choice as possible. It is still the right thing to do, please. The more people that do that, maybe we'll get away with it. Maybe if enough people mask, we can see those transmission rates stay low enough where we're not overly concerned about all those kids out there that are in school.
Danielle asks, are you reporting the COVID cases in those fully vaccinated?
Sure. Yes, absolutely.
So this is from Sandy. She asks, booster, 5 months or 8 months?
So right now, listen to me, people. No boosters right now. It has not been approved. ACIP has not discussed it or weighed in on it, although the White House has kind of said they suspect it, and Pfizer has said they think they want to do it. And so it certainly looks like it's going to happen in late September. And by the way, that will be probably 8 months from your last dose is what it's looking like. But please don't run out and get your booster right now, because it's outside the authorization. Everyone is go crazy about it's a emergency use authorization versus FDA approval. When it's an emergency use authorization, you do not want to go outside of the declared uses, and it's not a declared use right now, a third dose. So you won't have the protection you need. If God forbid you did have an adverse event, your doctor wouldn't have liability protection. Insurance companies won't pay for it, even though right now that's a moot point because there's no cost to it. But really, please wait until there's full approval. Right now, the only third dose we're recommending is for the severely and moderately immunocompromised individuals that have had mRNA vaccine, and they should get their third vaccine dose at least 28 days after their last dose. But that's only for immunocompromised people.
All right, next question. Monica, if an unvaccinated person has been in close contact with a COVID positive person, do they need to be quarantined?
Currently, the recommendation is they do not need to quarantine, but the recommendation is to test. Okay? Now, we're going to go back to the idea that quarantine is an individual who has been exposed but is not ill. If that individual gets sick, they should test immediately. Jen, Brandon Koshy says, she says, if an unvaccinated person has been in close contact. Is that what you said?
Right.
I'm sorry.
Yeah.
Okay.
That's okay.
If an unvaccinated person has been in close contact with a COVID positive person, yes, they do have to quarantine. Unless they've been positive in the last 90 days. So there's two ways to get out of quarantine: being vaccinated or having a COVID infection that's been proven. By the way, people, please make sure that it's tested, not just because you assumed you had COVID. There should be a positive test, okay, in the last 90 days. Those two situations, we would not ask you to avoid going to work and stay in your home and la-di-da. But I think being extra cautious in those situations is also requested. So those are the people who should be masking when you go out. Those are the people who should be getting a test probably around day 7 in a week. Certainly any signs of illness, mild or otherwise, should prompt you to get tested. If you have high-risk individuals in your home under those circumstances, pay extra attention to making sure that you avoid them, just to be on the safe side. I mean, this is just kind of common infectious disease 101 common sense, guys. We got to use our heads. And there may be a time where where we're going to change those policies, but for now, it is still primarily unvaccinated people that we want to quarantine. I hope I didn't confuse anybody with that. I apologize for misspeaking there.
Rebecca asked, why are we sending out threatening letters to people who are quarantined, threatening them to take into protective custody if they don't comply? I've seen letters circulating on Facebook from our county in Allegan. And you kind of mentioned this already about the warning letters.
Those are just standard letters. We didn't change that for COVID. Those are the standard warning letter we've sent out for years to people who are known infectious disease or exposed. It's taken right out of the public health code. If it's scary to you, that's because maybe part of the intention is to make you know that we do have some regulatory authority, and we want people to pay attention to it. So that's the reason. But I mean, we didn't make it up, and it certainly wasn't something we developed just to scare people related to COVID. It's a standard letter.
Okay. Jonathan said, the CDC says for my age group, 20 to 49, my survival rate is 99.8%. With knowing that, why should I get vaccinated?
Well, we get into the statistics. Well, first of all, because you can infect other people, and their chance of survival might be significantly lower than that. Okay, so now, do you really want to be the vector of a disease or an infection that's going to kill other people. The other thing is for the sake of the population, because somebody asked earlier, when are we going to be done with this? And we're going to be done with this when we can develop enough immunity to slow the transmission down. And that means people like you need to step up to the plate and vaccinate. We can't do this with just 65 and older is vaccinating. It's got to be the whole population. Right. And that's true. Good point. So just because you don't die doesn't mean you're not going to get sick as hell. This is not a walk in the park virus. Even young people get significant illness, can miss weeks of work, even if you're not hospitalized. We've all been hearing about long COVID, guys. It's nasty. It increases your risk of stroke and coagulability issues. There are lots of non-fatal conditions with this virus that you really don't want to experience. Not to mention lost work, right? We're talking about all this, so we want you to stay home. So there's a lot of social economic implications for this as well. Thank you.
All right. It's 4 o'clock, so we'll take a few more questions. A lot of these are masking, which is already covered, and we appreciate everybody's questions. If we don't get to your questions, please email them to covid19@stcounty.org. Okay, this is from Lisa. I keep seeing people say the test cannot differentiate between the flu and COVID. I cannot believe that's true. Is it true?
No, it's not. So we have COVID tests and we have flu tests. They're different viruses. The science behind it, the technology behind it can easily differentiate between a flu and a COVID infection. Are the tests perfect? No, they're not perfect. There's false negatives, false positives, but we've always been able to differentiate between different respiratory viruses. We have panels that differentiate influenza and RSV, and probably what we'll be seeing this fall is a panel that has all three of them, RSV, influenza, and COVID. Now, what our tests can't differentiate between is a COVID variant. So I cannot tell you whether you've got a Delta variant or an Alpha variant or a Lambda variant. It's just COVID is COVID with our tests. The state does that on their genetic sequencing, which can take a long time. But they have recently sent out that, I think, what did they just say, like 99% of their sampling in the last week has been a Delta. So we're assuming that Delta is just kind of the predominant thing.
All right, this is from Sandra. She says, if you can't get other vaccines due to an allergy, should you get the COVID vaccine?
Well, sure, because the only contraindication to a COVID vaccine is a previous reaction to the COVID vaccine or one of its components. It's different. Every vaccine's different. All vaccines are not created equal, and certainly even with a vaccine allergy to one, we generally don't make that a contraindication to receiving other vaccines. So you talk to your doctor about what your allergies are, but it certainly probably is not a contraindication unless you had your first dose earlier and you had a real significant problem.
The next question is from Cameron. If you have antibodies, should you still get vaccinated? What are the pros and cons?
Yeah, it kind of goes back to the conversation we had earlier. And the answer is yes. We don't know if your antibodies are protective. We don't know how valid those antibody testing are, what type of antibodies, what you need, et cetera. And there is no downside of getting vaccinated despite having antibodies. We know that the vaccine boosts your response and makes you a lot less susceptible to the virus, regardless of your pre-immunity state. This is why we tell people who've been previously infected, known infected, to go ahead and get vaccinated as soon as you recover. There's no waiting time there. So if you get COVID and you recover and you're in a short period of time, 10 days, you can get vaccinated as soon as you're out of isolation. Now, we would ask if you got COVID and somebody like me where you're sick for 4 weeks, 6 weeks. I kind of waited until I felt better to get my vaccine. So that kind of makes some sense too, because the vaccine does have a very reactogenic effect. Many people, I'm not saying most, but yeah, actually like 70% have some kind of body aches, sore arms. They feel a little sluggish after the vaccine. So you don't want to add that on top of feeling crummy from the virus itself. So wait till you feel better, but go ahead and get the vaccine. It'll help. Makes a difference.
Kimberly asked, when someone is exposed to COVID and has no symptoms, should they be tested before being around others? And if so, at what point, how many days out?
Well, yeah, Kim, that goes back to kind of that risk of exposure. So if you've had a very close exposure, especially in a household, I would say the majority, the highest risk transmission of the virus seems to be within families, right, within households. So if it's a household exposure, you're unvaccinated, I would think your risk is pretty high that you could get infected and you should be quarantining. Um, if it's a low risk exposure and you're vaccinated, that's kind of that's a call. If it's a high risk exposure and you're vaccinated, the advice is still to get tested around in about a week. You can go about your way, make sure that you're not sick, make sure that you're not ignoring symptoms. But if you feel well, getting a test, a COVID test in about a week is just that extra level of reassurance. We know that vaccinated individuals get less severe if they do get infected, it's less severe. And so you may not recognize that you got a COVID infection if you're vaccinated. That's where the testing can be very helpful.
So Christina asked, why don't they make you quarantine for the flu, but you have to for COVID?
Well, there's no comparison really. You can look at the data for flu, what we experience every year, 10, 30,000 cases. I mean, flu can be nasty, no doubt, but we just don't see, and it's not nearly as transmissible. It's not as infectious. This is just a whole different ballgame. I would think that if we had a really bad flu season, and there have been a couple situations I remember where we really did have like some outbreaks and we did recommend people to quarantine, but we did it in a more localized situational way. This is a situation where it's affecting everybody and everyone everywhere, and it keeps coming back and banging us over the head. So the idea of maintaining the things we know how to do and trying to get them to work better, we just can't give up. You just can't throw up your hands and say, oh, well, let's just this infection just like kill whoever it wants. I personally don't think that's the right approach, and I hope most of you don't either.
Sheila asked, I got the Johnson & Johnson at the beginning of March. I have MS and I'm hearing about boosters, but I don't want Johnson & Johnson and haven't heard anything about theirs anyways. Could I get another one?
Yeah, that's a really good question, Sheila. And I have to say I am hearing that Johnson & Johnson is looking at a booster dose and has some data that is submitted accordingly. But like everything else, it's going to take a while to work through that bureaucratic process. If your doctor feels very strongly that you are immunocompromised and at risk and you need a booster, you can go outside and get a mRNA vaccine, even though you received the J&J. The general advice, we want people to get their a third vaccine, the same kind they already got, right? But there are situations where it's just not possible, and I think that has to be discussed with your doctor one-on-one. We'll know a lot more again, probably a lot more about this interchange of vaccines and boosters. We're going to know a lot more over the course of the next year. So rest assured that whatever immunity you got from the J&J is probably still helpful to you. Another good reason for everyone to get vaccinated. Going back to that guy said, I'm 29 and I'm not likely to die from this. Why should I bother? For the people that we just talked to who are struggling and maybe don't have as good an immune response, their protection relies on the rest of the community being vaccinated. So, it's just not all about us. It's all you. It's about everybody.
All right. Well, it's 4:08, so a lot of these questions, Doc, are really passionate about the masking, and I know you've gone over that before. So I think it's time to wrap up and do your closing comments. Again, people can email questions to us at COVID-19 at stclaircounty.org.
COVID-19 at St. Clair County. Look for our FAQ. We'll try and be as transparent as possible. I know that they're passionate about masks. There's a lot of things to be passionate about. I struggle with why we're passionate about a piece of cloth over your mouth when I count bodies every day, right? And we're counting and watching hospitals surge and watching people go bankrupt because of was it $50,000 average cost of a COVID hospitalization? We are having profound difficulties as a society because of this virus. So we need to weigh all of that into our decision-making process, not just the fact that a mask may or may not be effective and all this stuff. So I understand your passion, but do understand that we have a much broader scope of concerns that we have to consider as we move through this next wave, as we move through this next year. We're in this together, people, and the sooner we work together, the easier it'll be. And I'm hoping that we can do that amiably and kindly. And I'll listen to you if you listen to me. Okay, thanks so much.
See you next week.